Right. Good afternoon, everyone, and thank you very much for joining us for today's webinar entitled Toward a Healthier, More Equitable, and Cleaner Transport Future for New Jersey. My name is John Carnegie. I am the Executive Director of the L&M Voorhees Transportation Center at Rutgers University. I'll serve as the MC for the program today, and I'll also provide some brief remarks to give you some context for the webinar in just a few minutes. But before we do that, I'd like to ask Jean Herb and Zoe Baldwin to say a few words of welcome. Jean?
Thanks, John. Thanks so much. I am a colleague of John's at the Rutgers University Blaustein School of Planning and Public Policy. And one hat that I wear is I co-facilitate the New Jersey Climate Change Alliance. And when I'm done talking, I'll put the website link into the chat box. The Alliance has been actively involved in advancing science-informed climate solutions for almost 12 years now, which is incredible. And it's an organization that sort of works as a collective, a network of networks in a lot of ways, with almost 70 different organizational leaders from around the state, including the Regional Plan Association, who's intimately involved in this project. And the Alliance advances long-term climate solutions, both with regards to resilience as well as emissions reduction. We have been very active on issues associated with health and equity, and we knew that we wanted to work in the transportation space. So the Alliance's transportation work group took a little bit of time to better understand what kind of work was happening in New Jersey with regard to transportation and climate change. And we felt that this space, in terms of planning for long-term changes in mobility that are just, clean, equitable, and resilient, was a space that was one that was not only not deeply being advanced in New Jersey by any particular organization, but also is one that could really benefit from the sort of Alliance's operations as a consensus-based organization with many diverse partners. So we brought on John Carnegie to help us lead this, and he has been an amazing and visionary leader, and we're grateful for all his support. Zoe Baldwin from the Regional Plan Association chairs the Transportation Work Group of the Alliance, and I'm happy to turn it over to her to say hello.
Thanks so much, Jean. Welcome. I hope everyone had a great weekend. Again, my name is Zoe Baldwin, and I'm the New Jersey Director for the Regional Plan Association, which is a 100-year-old nonprofit civic organization working towards economic health, environmental resiliency, and quality of life in the tri-state area. But today I'm here as the chair of the Transportation Working Group for the Climate Change Alliance. And I'd first like to thank all of our panelists and all of you for participating in what I'm hoping is the start of a transformative conversation about mobility and how a re-examination of our built environment is necessary to advance our societal and our environmental goals. And so this conversation couldn't have materialized at a more perfect moment in time. We're about to receive a significant increase in federal infrastructure funding, and at the same time, we're seeing a national policy conversation shift and bring a much needed focus to racial justice, equity, decarbonization, and community. And so I want to remind everyone, this is the first in a 3-part series. And so I hope that we can whet your appetite today and entice you to come back, especially as we move into our county specific sessions, which will be in the early part of next year. And other than that, I just want to thank you again for joining us today for this important conversation, which I certainly hope translates into tangible improvements to our built environment and the policies that shape and govern our communities. So thanks so much, and I'll turn it back over.
Excellent. Thank you so much, Zoe and Jean, and thank you for your leadership and participation in shepherding our project that I'm going to tell you about in just a few minutes. Before I do that, though, I wanted to, for everyone here who's here online, I wanted to give you a quick reorientation to Zoom if you haven't been here in a while. You are going to be participating in the event without the use of your video and on muted. However, we hope that you will take full advantage of the chat and question and answer function of Zoom, which you should find at the bottom of your screen. We hope that you can contribute to sort of reflections and observations, as well as commentary in chat throughout the afternoon session. And if you have specific questions for any of the panelists, you can insert those in the Q&A function of the app. So I wanted to also mention a little bit about the Voorhees Transportation Center. As you know, the webinar today is being convened by the Voorhees Transportation Center in partnership with Climate Change, New Jersey Climate Change Alliance. And we are one of the 15 or so research centers and institutes at the Bloustein School of Planning and Public Policy here at Rutgers. Our mission is really focused on transportation research, planning, and policy development. It includes multiple threads of research that cover a range of topics, including transportation systems and performance, transportation finance, transportation and land use, resilience. We have a very strong program related to active transportation and mobility safety, health and transportation, equitable mobility and environmental justice and transportation planning, as well as transportation, climate change, and emerging technologies and modes of transportation. So we have a wide array of topics and expertise at the Voorhees Transportation Center, and much of our research really happens at the intersection of many of these different areas of planning and policy, and this project is certainly one of those projects. The webinar is being conducted as part of a project that I'm going to tell you about right now. It's called Planning for Healthy, Just, Resilient, and Carbon Neutral Mobility in New Jersey, and that project is has been funded thus far through the generous support from the New Jersey Climate Change Resource Center and Energy Foundation. And as Jean has mentioned and Zoe mentioned, the work that we're doing is in the context and is being shepherded by the transportation work group of the New Jersey Climate Change Alliance. So when we conceived of the project about a year ago or so, we were in part responding to changing policy dynamics at the state and federal levels, where kind of energy policy, climate policy, environmental justice policy were converging, really to provide some new opportunities, some exciting opportunities to think a bit differently and more holistically, perhaps about our transportation future. And this was true with the maturing Murphy administration here in New Jersey, as well as the new Biden administration. So as is the case throughout the world, certainly in New Jersey, our emissions reduction targets are quite steep, and much of the emissions that needs to be adjusted, a significant share of it is coming from the transport sector. So that's really the context of this project. And we knew also that there was a significant amount of attention being paid, as there is nationally, being paid here in New Jersey, to decarbonizing the transport sector by facilitating the transition to electric vehicles. And that's really obviously a very important and significant part of the challenge. However, we were looking for a way that the Climate Change Alliance could sort of add value and address perhaps some other aspects of decarbonization in transportation that were getting a little less attention. So we thought a little bit about that and came up with the idea that a one-for-one exchange of fossil fuel powered vehicles with electric vehicles leaves a number of important community and planning goals sort of unimpacted. For example, the physical footprint of transportation infrastructure would remain largely the same if it were just a vehicle exchange for cleaner vehicles. And while it's really important to transition to cleaner vehicles, reducing vehicle use and vehicle miles traveled is equally important, perhaps, and can derive other concurrent benefits. And that's what our project is really trying to achieve. So we're moving forward with a project that is designed to reduce the carbon footprint of mobility, the mobility system in New Jersey. And we're exploring the decarbonization of the transport sector through this kind of multi-goal framework that we think will allow us to bring about a healthier, more equitable, and cleaner transport future for the state. One that improves health outcomes for people and communities by improving air quality and making it easier and safer to walk and bike and to have more physically active lifestyles, promoting equity by making travel by transit and shared use options more affordable, reliable, and convenient, and by enhancing access to opportunity for marginalized groups. Increasing transportation system efficiency and effectiveness by integrating advanced and emerging transportation technologies and modes, but as I'll mention in a minute, making sure that those are accessible to all segments of New Jersey's communities. And then finally, adapting infrastructure to climate hazards, but also ensuring that services are flexible and responsive to change, as well as well coordinated. So we think this multi-goal framework will allow us to kind of focus on the decarbonization challenge through a series of kind of guiding concepts that are central to the overall project. And those include empowering people to drive less, creating a network of diverse and inclusive neighborhoods that brings in the built environment along with the transport decarbonization challenge. Thinking about mobility more as a service and reimagining the delivery of public transportation services in New Jersey. Embracing new technologies, but ensuring they're affordable and accessible to everyone. And I think perhaps most importantly, making social justice a key indicator of transportation performance. So when with these as the sort of guiding principles, we set upon doing some research and investigation into what the current thinking is around planning and policy in the context of healthy, just, and more resilient mobility patterns and transportation infrastructure. And I think during the pandemic, this concept of a 15-minute city or neighborhood emerged especially in Europe, but also in places in the United States, as perhaps a way of kind of regrounding the way we think about communities and transportation in this idea that everyone should have available to them the resources, the destinations, et cetera, that they need to live prosperous and healthy lives within a 15-minute travel distance or something like that. So this concept not really, I mean, it brings in some of the fundamental concepts of urban design, both in Europe and the United States, but gained a bit of prominence in the popular media and seems relatable to people in general. Although we want to make sure that we're taking a critical look at what a 15-minute city or neighborhood might mean and what a network of them might mean. And you'll hear a little bit about that sort of critical edge to this as part of our webinar presentations today. So a 15-minute city is essentially a look at travel time and being able to reach the destinations you need to reach within a 15-minute walk, a 15-minute bike ride, a 15-minute car ride, or et cetera. The basic definitions of the 15-minute city are really the geography where most human needs and many desirable locations are within travel distance of that 15 minutes. So we're exploring this concept of 15-minute cities and the guiding concepts that I mentioned just a few minutes ago in two phases of work. The first phase of work kind of focused on the systems level look at relationships, key relationships. And we're doing those in 8 case study locations in New Jersey, which include Atlantic, Camden, Cumberland, Essex, Hudson, Mercer, Middlesex, and Warren. And that's 5 in the central and northern parts of the state, and then 3 in the southern part of New Jersey. We think these places and these counties bring in a kind of rich diversity of landscape that is representative largely of New Jersey's landscape. So we're hoping that what we learn in these places is useful statewide. I mentioned that we're looking at these key relationships. We're really looking at the characteristics of people and places and the connections between them at different scales, the neighborhood scale, community scale, and regional scale, to see how these relationships come together to provide a supportive or a not supportive framework for promoting and advancing healthier, resilient, and carbon neutral mobility pattern in the future. And we've done a significant amount of desktop research in the first phase of work in those 8 counties, and that research will be a foundational input into a number of county-specific visioning workshops that we'll conduct starting in January. And one of the sort of fundamental aspects of that, the culminating aspects of that analysis was applying this idea of 15-minute accessibility to the landscape, largely replicating a methodology that was used in Portland, Oregon. And this one map here is an example of a series of many maps that we've developed for each of the counties, but it shows the places that are from a measured accessibility perspective seen as more accessible in the yellows and the hotter colors, the reds and yellows, and less accessible in the cooler colors, the blues and the purples and things like that. Overlaid here on this map, if you can see it, is a number of census blocks, which are outlined in red, and those are actually low-income census blocks. So one of the interesting and findings that we'll need to dig deeper with in terms of the next phase of work is why those places that from a measured accessibility perspective appear to perform not as well from an outcome perspective. These are the places, many of the places that are lower income and have many of the challenges that we identify with places that have less opportunity. So that is a sort of an input and intriguing finding from across the state in all the locations that we looked at that we hope to dive deeper into as we move into our next phase of work. But before we do that, before we move on to phase 2 of our work, we have brought together this webinar today, which we've assembled, I think, a great panel of speakers doing work really across the country. And we're hoping that this webinar will both inform, excite, and maybe entice you to stay tuned to the project and hopefully participate in one of the 8 county visioning workshops that we'll be conducting in January. So without further delay, let's get started with our panelists. And first up for today will be, I'm going to stop sharing so Curtis can share his slides while giving his bio. Our first panelist today is Curtis Ostrodka. He is Director of Smart Communities at VHB Consultancy. Kurt leads collaborative teams that address complex community and mobility planning issues throughout the country, including future-ready smart cities, regional visioning, corridor redevelopment, and healthy community design. His focus is on building smart communities that leverage technology and innovation to improve sustainability, resilience, and equity. And he led the Paramore Comprehensive Neighborhood Plan, a healthy community design-based plan that won the 2015 American Planning Association Florida Chapter Award of Excellence. He also developed a healthy mobility model to analyze baseline health conditions at the census tract level, assess health risks, and recommend potential design improvements to clients. You're going to hear a little bit more about that model as part of Curtis's presentation. And Curtis, thank you so much for being here.
All right, thanks so much, John. Can you hear me okay?
Yes.
Okay, great. Well, I'm very excited to be here. Thank you for the introduction. Very excited to be part of this great panel. So I am here today to kick us off and tell you a little bit about the work we've been doing and the potential applicability to the work that you are doing in New Jersey. I am located in the VHB office in Orlando, Florida, but work across our company footprint as we develop this model and other data-enabled and technology-enabled solutions for our clients. So I'm here today to talk about health and wanted to start with kind of the 101, maybe the 201 version of how the built environment has affected our health over time. So when we think about the factors that do determine our health, some of them you can't see. It may be your family health history. We probably all have, as we're filling out our doctor's information, have to talk about if our near relatives had any recent concerns or family health factors that could affect us today. There's also our behaviors and lifestyles. So do you regularly get physical activity, or do you take the within your 15-minute neighborhood, or do you use an automobile for all of your daily trips? And that brings us to, of course, the built environment. where unfortunately this country has placed the needs of the automobile over the needs of the pedestrian, and results in unhealthy behavior that can be very unsafe from a crash perspective, from a physical safety perspective, but also exacerbates those unhealthy lifestyles that we tend to lead. Because if walking and cycling or taking transit isn't the easy choice, then people will be discouraged from doing so. And you've probably seen statistics like this before, but I think it's relevant, particularly for me, having young children myself, and then also having my experience of walking to school every day. Pretty sure it was 2 miles uphill each way. But the proportion of children that walk or bike to the school has fallen pretty dramatically over 2 generations. And there's a lot of factors involved in this, from a safety perspective of parents, but it really comes down to how we've developed our neighborhoods and our subdivisions, again, to put the emphasis on the needs of the automobile over the needs of children who want to walk to school. And you can look at kind of across the country, the trends, of course, are not going in the right direction. 1995, you see a lot of green and yellow on the map. And by 2016, this is a measure of obesity. There's no green left on the map. It's all pretty dark red or purple, showing that the trend is moving in the wrong direction from a public health standpoint. And that's the case also for diabetes. So these chronic diseases are largely a result of family lifestyle, of physical activity, but also the way we've developed our built environment. And that comes at a great cost to our checkbooks. So not to go through every number here, but if you can see how we spend just so much on healthcare per person and don't really get a great return for that. I sure would like to see that money spent somewhere else on transit or on electrification of the grid and making us more resilient, rather than taking care of problems that we've created for ourselves. So over the last 5 years, maybe 10 years or so, we've seen a convergence of bringing public health into the urban planning profession, which is my background as well. And we have worked hand in hand with public health departments and doctors, because the doctors and health professionals have realized that they're at the wrong end of the pipe. They are treating the symptoms that result from inactivity, but are not treating the root cause, which is the environment that people grow up in. We did a number of healthy community plans, and we realized that they were all very qualitative. We didn't really have good data to back them up. Health data is fairly easy to find at a countywide level or at a regional level. But if you're trying to do, say, a neighborhood plan or a corridor plan, it's very hard to find data for specific populations. So what we did, we've been developing this tool over the last 5 years. We took our knowledge of healthy community design principles, which are many of the things that John showed earlier in the 15-minute neighborhood presentation, combined that with open data and big data that's available, and combine that with GIS technology to create some mapping overlays. And so we call this model healthy mobility. We're looking at how we can analyze different land use and urban design and transportation factors that affect community health. We can then establish a baseline for that and then determine whether or not we're making a difference in some of the treatments that we could recommend. So the model uses 2 different tiers. I'll walk through them briefly. The first one, the inputs include US Census data, which is very easy to come by. And then we also use a data set developed by the CDC called the 500 cities data, which includes those 6 chronic diseases listed below. This data that is published by CDC is based on behavioral risk factors So it was not a true health impact assessment or like a door-to-door survey of people. So it in itself is a projection. And it's great to have if you live in one of the 500 largest cities in the country. But if you live in an unincorporated area, you are not included in that data set. So as I mentioned, being down in Florida, we first studied our state. You can see the 500 cities data sets for the state. There's about 18 metro market areas. What we were able to do is use the urban design and mobility characteristics, as well as the 500 cities data, and use what's called an ordinary least squares regression model in order to project out the health conditions that one would expect outside of the 500 cities. So we were then able to, again, using regression analysis and statistics, be able to fill in all of the missing parts of the map. And then the color code shows green being 10% better than the statewide average, yellow being the statewide average, and then red being more than 10% worse than the statewide average for those 6 health criteria that we listed before. This is an image of our web portal that we've created, and we have now done this assessment for the entire Eastern Seaboard. So I zoomed in around the Rutgers campus here on one of the census tracts. And I'm not familiar with the campus. So John, you'll have to tell me if these results are about what you would expect to see based on your knowledge of the demographics. But you can see we have an aggregate score showing that this census tract happens to have a very high risk for these 6 indicators of chronic disease. This measures against the entire state of New Jersey. So to take this and get a better look, you would want to calibrate this to just the county that Rutgers is located in. So when you're thinking about your next steps through the visioning workshops, you would want to calibrate just for Camden or just for Mercer or just for Warren, so that you're giving yourself a relative comparison within the county instead of a comparison to the entire state of New Jersey. So that is what we call our tier 1 model, which looks at kind of the baseline. The second part is we can do some scenario planning and add in additional urban design characteristics, transportation characteristics, such as sidewalk width, such as the number of lanes on a road, vehicle speed, whether or not there's on-street parking on local roads. That gives us a more detailed look at these census tracts, and we can then again find the statistically relevant factors that have the greatest correlation with health, and that would then allow us to recommend some specific solutions. Here's an example we did in the city of St. Petersburg in Florida. This area is where the Tampa Bay Rays have their baseball stadium. The Tampa Rays have been considering moving for several years. So the city wanted to understand what could they do with this giant piece of land if it were to be redeveloped. So we did our analysis around the area, determined that 6 out of the 10 census tracts adjacent had very high incidence of the chronic diseases we're worried about: obesity, diabetes, asthma. And the statistical regression showed that areas that had parking behind buildings, so a more new urbanist style of development, rather than the large seas of parking lots up front like you'd see in a big box, those areas tended to have lower incidences of the chronic diseases. Same thing for areas within a half mile of grocery stores or healthcare providers. I mean, that's kind of obvious, right? But it shows that there was no barrier to access, and it provided some actual statistic relevance for that thought. I think as planners, we believe intrinsically that the street trees and slower speeds and sidewalks will solve every problem we have. And that can be true in some cases, but this provides a more quantitative way to measure that. We've also used this on a regional scale. So this is our metropolitan planning organization called MetroPlan Orlando. they just did their long-range transportation plan. It's called the Metropolitan Transportation Plan for 2045. And as you can see, we were able to incorporate the model results as one of their evaluation factors for prioritization of new projects. So whether or not something had an impact on health, that could potentially receive more priority than a project that just addressed, say, capacity. So I'll conclude by talking about how this model can be used in a variety of settings. We talked about creating that baseline health profile that can be looked at for existing conditions. So this could be a substitute for, again, doing a full health impact assessment, which tends to be pretty labor and time intensive. We've used this successfully on neighborhood studies. So we can see, again, at a sub countywide level, you can look at the different census tracts and give you a better idea of where vulnerable populations are. And then also give you a better sense of where you can do a targeted health intervention. So by doing that modeling and that alternatives assessment, you can do some testing of different alternatives. So you may say, what if we introduce a series of parks in several census tracts? Can we now model that to see if it has a statistical correlation to improved health impacts? We could do the same with trails, with bicycle facilities, or by changing the transportation network. So one of the things we think is pretty important about this is, again, to be able to prioritize transportation projects that we believe, based on the statistics, would have a greater impact on improving community health than other projects. And this is a tool. It's not a magic bullet for for replacing good urban design and good transportation planning. But it does give you another means of doing that assessment. So it gives decision makers, a little bit more information for making those hard choices. So I will turn it back over to John. If you'd like to learn more, you can go to our website here or contact me. And looking forward to the other presentations as well as the Q&A.
Excellent. Thank you, Curtis. And I should have said that we are monitoring the Q&A throughout the program, and we'll be incorporating those. Curtis, if you could stop sharing. We'll be incorporating those questions when we get to that, but we're going to actually hold the questions until all of the panelists have had an opportunity to make their presentation. Thank you very much again, Curtis, for that presentation. Thanks very much for being right on time. This is great. Next up will be Dr. Reagan Patterson, who is a Transportation Equity Research Fellow at the Congressional Black Caucus Foundation, where she conducts intersectional transportation policy analysis and research. Prior to joining the Congressional Black Caucus Foundation, Dr. Patterson was a postdoctoral research fellow at the University of Michigan Institute for Social Research. She earned her PhD in environmental engineering at the University of California at Berkeley. Her dissertation research focused on the impact of transportation policies on air quality and environmental justice. And Dr. Patterson holds a BS in chemical engineering from UCLA and an MS in environmental engineering from UC Berkeley. Welcome, Reagan.
Hi, thank you so much. Can you hear me?
Yep, all good.
Okay, great. And thank you for that introduction. Again, my name is Dr. Reagan Patterson, and I am the Transportation Equity Research Fellow at the Congressional Black Caucus Foundation. I'm located in Piscataway or Anacostia land, also known as DC. And I'm excited to be a part of this timely conversation. As Zoe mentioned, it is a very timely conversation on achieving healthier, more just, and cleaner mobility, particularly with respect to multi-goal frameworks that go beyond electric vehicles. And the title of my talk is Just Mobility. And so kind of a continuation from the healthy to now just. And so this image is from the California Bicycle Coalition's article, Why California Should Decriminalize Jaywalking. Cal Bike sponsored AB 1238, the Freedom to Walk Act, which would have removed jaywalking laws. Unfortunately, the governor did not sign it, but it would have removed jaywalking laws. And as Charles Brown of Equitable Cities says, mobility justice is really about freedom. So let's begin with definitions. The Redlining Institute defines mobility equity in its mobility equity framework as, quote, a transportation system that increases access to high quality mobility options, reduces air pollution, and enhances economic opportunity in low income communities of color. And this is a more infrastructure focused definition. And Dr. Destiny Thomas of the Thrivance Group states, quote, mobility justice is less about mode choice, although that's important, and more about freedom of movement, freedom to navigate space and place in the absence of racism. So again, this is about freedom, people moving freely in space and place and being able to return and make it home. And that requires us challenging racism built into our built environment. One major barrier to each aspect of those definitions, whether it's reducing air pollution, mobility options, economic opportunity, and freedom of movement, is car-centric planning practices, facilitated by investment prioritization of highways, which have been weaponized as tools of oppression. Following the Federal Aid Highway Act, highway construction and urban renewal or Negro removal programs inequitably impacted the Black community. Freeway construction resulted in the demolition, division, and displacement of Black neighborhoods, as well as the destruction of local economies. And this image is of, or these images are of Chrysler Freeway, also known as I-75, I-375 in Detroit, which paved over two Black neighborhoods, Paradise Valley and Black Bottom. So on the left, you see Hastings Street, which was this main thoroughfare through Paradise Valley and Black Bottom. And on the right, from the same view, you see what resulted from the highway construction. And it's important to note that this practice continues today. So often we frame it as an historical practice, but it continues today. And for example, the Washington Post recently wrote about the planned widening of I-526 in North Charleston, South Carolina, for which 94% of displaced residents live in Black and Brown communities. So as this map shows, all of the buildings in like an orangish brownish would be relocated or torn down. And then also a lot of land owned by Black folks would also be taken by eminent domain. So due to racism in transportation and housing policies, people of color are more likely to live near major roadways. For instance, 24% of African Americans live near highly trafficked roads. And this contributes to racial disparities and exposure to traffic-related air pollution. 9% of Black adults and 14% of Black children have asthma, and exposure to traffic-related air pollution is associated with asthma as well as many other adverse health effects. African Americans actually have the highest rates of asthma morbidity and mortality, with greater disparities for Black children. Now, with respect to mobility options, 20% of Black households don't have access to an automobile. And this is the highest percentage among all races and ethnicities. And 1/3 of low-income African Americans live in a zero-vehicle household. And so in an automobile-dominated transportation system, this hinders the ability to reach destinations and increases vulnerability to disaster. Almost 1 in 4 public transit riders are African American. Underinvestment in public transit has led to fare hikes, service cuts, and poor connectivity. Black workers have the longest average public transit commute time, and public transit schedules prioritize the 9 to 5 commute, which creates barriers for part-time, service, informal, and care work. A lack of access to reliable, accessible, and frequent service contributes to, for instance, Black bus riders in Boston spending 64 more hours per year traveling than white riders. And further, gentrification, rising housing costs, and decreasing affordable housing stocks are pushing African Americans out of cities to areas with fewer mobility options. Now, to begin to really get to this idea of freedom of movement, we must look at safety. Safety is often framed in relation to traffic-related injuries and deaths. 18% of traffic-related pedestrian deaths are African American, and Black pedestrians and bicyclists are more likely to be hit and killed than white ones. Unsafe street infrastructure, such as inadequate sidewalks, lighting, signage, and crosswalks all contribute to this. And Smart Growth America's Dangerous by Design 2021 report states that from 2010 to 2019, Black pedestrians were killed at an 82% higher rate than non-Hispanic whites. Traffic fatalities actually increased during the pandemic, with a 23% increase in the number of Black folks killed in 2020. And again, this is due to unsafe street infrastructure and more roads being located in Black communities that encourage speeding. Another aspect of safety and a major contributor to racial disparities in transportation-related fatalities is policing. Nationally, Black drivers are 20% more likely to be stopped by police than white ones. The most common police-initiated contact is the traffic stop. Racial disparities in traffic stops vary across states and cities, but together this has deadly consequences, as a disproportionate share of people shot and killed by police at traffic stops are Black. I call your attention to Sandra Bland, who was found dead in a jail cell after being arrested during a pretextual traffic stop, Philando Castile, who was shot and killed during a traffic stop, and Dante Wright, who was shot and killed by police at a traffic stop in Minnesota. And I say their names and share their stories to convey how the movement of Black folks is hyper-policed with deadly consequences. And the over-policing of Black communities is not confined to those in cars. In addition to driving while Black, biking while Black, and walking while Black are also experienced. For example, in Chicago, twice as many bike tickets are written in Black communities than in white areas. And in Jacksonville, Black pedestrians were 3 times as likely to be ticketed than white pedestrians. In LA, Black folks receive nearly 1/3 of all jaywalking citations, while only accounting for 9% of the city's population, as shown in the figure on the screen. And so this is a clear example of where inadequate infrastructure meets racialized policing. And again, this has deadly consequences. I call your attention to Dijon Kizzee, who was killed in LA after riding his bike in the wrong direction. Karan Hilton Brown, who died in a car crash here in DC while being chased for riding a Revel electric scooter on a sidewalk without a helmet. And Kurt Andres Reinhold, who was killed in San Clemente for jaywalking. Hence the bill mentioned at the beginning of my talk to decriminalize jaywalking. So when we talk about transportation futures, the topic of this conversation, the solution is often reduced to electrify and automate. But as the image shows, gasoline or diesel vehicles, electric cars, autonomous cars, Uber and Lyft cars are all what? Cars. As such, they continue to rely on these same infrastructures of harm, thereby not challenging racism in planning. Further, with respect to electric vehicles, they do not address issues of access. For example, 3% of hybrid vehicle buyers and 2% of plug-in electric vehicle buyers in California are African American. And I use these stats because California accounts for half of all electric vehicles in the US, so I figure it provides a preview of what we can expect elsewhere. And we're seeing racial disparities in financing and charging infrastructure investment. So achieving just mobility requires anti-racist planning that reduces and eliminates harm. It's time at this moment, a moment that is the legacy of both historical and contemporary transportation policies and practices, to imagine a new transportation system. In terms of infrastructure-focused definitions of mobility equity, this can look like reconnecting communities divided by highways. The Infrastructure Investment and Jobs Act invests $1 billion to reconnect communities, and the Build Back Better Act, which was passed the House, includes an additional $4 billion for neighborhood access and equity grants. An example is the I-375 improvement project in Detroit. I-375 is a 1-mile freeway that connects to I-75, which I showed earlier. And the Michigan Department of Transportation plans to replace the sunken highway with a street-level boulevard lined with sidewalks and bike lanes, reconnecting the neighborhoods along the former Hastings Street, which you saw, which does enable enhanced mobility. More explicitly, in terms of freedom and movement, is free, accessible, reliable, and safe public transit. And often folks aspire to accessible, reliable, and affordable, but freedom of movement requires free. Boston's recently elected Mayor Wu, excuse me, recently extended Boston's fare-free bus services. And Congresswoman Ayanna Pressley, who's also from that area, so lots going on there, introduced the Freedom to Move Act, which would provide grants to support fare-free transit and require grantees to decriminalize fare evasion. So as we see, the Freedom to Move Act and the Freedom to Walk Act recognize that Black bodies and their mobility, regardless of mode, so walking, biking, in a car, have always been criminalized, codified from slavery to the Black Code to now. And mobility justice necessitates decriminalizing mobility to empower the freedom of movement and ensure livable futures. And so I look forward to discussing transportation futures further with the panel. Thank you. And so if you would like more stats from my report in regards to equity, I can be reached here. And these are some of the reports that I've done with the Congressional Black Caucus Foundation. Thank you.
Excellent. Thank you so much, Reagan. That was great. Again, we'll do questions and answers after we have an opportunity to hear from all of our panelists. Please do put your questions and answers in the Q&A function of Zoom. And also, if you want to make any observations or statements or whatever, you can do that through the chat function of Zoom. All right, our third panelist this afternoon will be Brianne Eby. She is a senior policy analyst at the Center for Transportation, where she conducts research and analysis on multimodal transportation issues. Her recent research has covered topics including congestion pricing as a tool for urban transportation sustainability and equity, transit bus operator workforce challenges and opportunities, transit system governance, and transit project delivery in the US and abroad, in particular issues associated with environmental permitting and review. Across all these areas, Brianne's focus of interest is on transportation's implications for climate change. Her academic background is in experimental psychology. She has a BA from Indiana University and MS from the University of Colorado at Boulder, and she is interested in bridging the domains of behavioral science and policy in an effort to help policy decision makers arrive at people-informed decisions. All right, Brianne, you're up.
Okay, thank you, John, and thanks so much to the New Jersey Climate Change Alliance for hosting me. I'm really looking forward to the discussion after the presentations conclude today. So as John said, my name is Brianne Eby, and I'm a senior policy analyst at the Center for Transportation. So real quickly, ENO is a transportation policy think tank. We're based in Washington, DC, and I'm on our policy team, which means I conduct research and analysis really on any transportation policy issue. A lot of our work is federally focused. My personal research tends to fall kind of in line with public transit issues. I'm looking right now at, as John mentioned, delivering rail transit projects. What does that look like? How can we do that better in the United States? Transit bus operator workforce development issues. So really runs the gamut. But my academic background is in climate change and sustainability, and how I'm always looking for how to bring that lens into any kind of transportation policy issue. So today what I'll be talking about is the concept of resilience in transportation. And I wanted to start real quickly by just defining what it is that we mean when we talk about resilience in transportation. I think there's different ways of thinking about that. And the notion of resilience that kind of most commonly or most easily comes to mind for me is thinking about physical resilience. So the ability to withstand or bounce back from extreme events that affect transportation systems. So this could mean building solid infrastructure to withstand climate change or extreme weather events. Could also mean building cyber-secure transportation systems. Many of us might remember the Colonial Pipeline issue from earlier this year and the effects that had on folks' ability to drive or to get around to access gas for their vehicles. So both of these, I think, are different ways of thinking about physical resilience in transportation. But what I want to talk about today is more of a social or human-based sense of resilient transportation. And so what I mean when I say that is having and designing a transportation system that enables people to get to where they want and need to go. And so there's a couple of different ways of thinking about this. One of them is in terms of mobility. So the ability to get from point A to point B is what I mean about when I say mobility. Another sense of a kind of human-based resilient transportation system is accessibility. And I sort of tend to think this is more important. When we think of transportation, we think of going places, that point A to point B sense of transportation, but I think accessibility is so critically important and something, a way of framing transportation that often gets missed. And what I mean by accessibility is all people, no matter income, race, physical ability, gender, have the ability to easily, safely, and comfortably reach the jobs, opportunities, and services that they need to get to. And the key to having a transportation system that promotes both the accessibility and mobility outcomes is having multiple different transportation options available. So a transportation vision that depends on cars alone, even electrified cars, doesn't work for everyone. So let's unpack that, because I think that's maybe something that might be controversial for a lot of people. We're certainly in this country kind of emphasizing an electric-centric transportation vision. So what might it look like to pursue a transportation vision that prioritizes all modes? Why does the current transportation system, which prioritizes single occupancy vehicle mobility only, why does that not work for everyone? And why does an approach that emphasizes multiple modes, why might that be more resilient? So I actually think Dr. Patterson did a really excellent job at teeing up a lot of the points that I wanted to make with some really fantastic stats. So I'm glad that I didn't reiterate a lot of the same statistics that she had, but I want to touch on a lot of the same points that she made about why a car-centric vision for mobility is maybe not the most equitable. It doesn't serve everyone. So urban areas have limited space for the continued expansion of vehicles and vehicle access. If we think about it, it takes space to store personal vehicles. Many of us have had experience with congestion and sitting in traffic in cities or on the highway. That inherently inhibits economic opportunity or the ability to access, again, goods and services. It's not good for businesses. It increases pollution. So, congestion is not great for a vision of resilient mobility. Vehicle ownership is expensive, and that is especially true for low-income Americans. Owning and operating a vehicle comprises a considerably higher portion of low-income individuals, total expenses, and so that's something that needs to be factored into consideration. Beyond the monetary cost, though, there's also opportunity costs that are associated with living further away from dense urban settings and having to rely on a vehicle to access all of your destinations. Safety is a huge point. We have 40,000 fatalities due to automobiles in this country per year. That's a number that should be considered unacceptable, but yet many of the policy making, the ways that we're designing policies just maintains that level of fatality and injuries in the country. And then finally, this came up in Kurt's presentation, just having the desire to pursue healthier active transportation options. As somebody who is a bike commuter myself, I love that that's kind of my built-in exercise in the day. And so a transportation vision that prioritizes vehicles makes it harder for people to choose healthier and more active transportation options. And so across all of these challenges, I think the way to address them is, the main goal should be to move toward a transportation system that ultimately is not divorced from the environment or the context in which it sits. And, I think the challenge with electrification is that we don't necessarily need new tools to address some of the challenges, whether it's climate or equity or, any or financial challenges of our transportation system. We don't need new tools, but we do need new policy approaches or ways of thinking about how we build our transportation system. So what do I mean by recognizing the environment in which transportation sits or designing a system that's not divorced from its environment? So number one, there should be synchrony between transportation and land use policy. That's something that is historically pretty they're disparate, they're thought of in disparate ways. And, the response to sprawling development tends to be to add new lane miles. So what are some policies that might encourage denser development? Well, some examples in Minneapolis, Minnesota in 2018, the city eliminated single family zoning and parking requirements. So this is an attempt at bridging land use and transportation policy that I think helps to situate transportation in the broader physical environment in which it sits. Another factor, there should also be an emphasis on connecting communities. Again, Reagan did a really fantastic job at talking about the connecting communities legislation that's in the Infrastructure Act. So right now, by emphasizing automobiles, the current transportation system has created physical barriers between communities, and specifically, the development of the interstate highway system in the mid 20th century resulted in the demolition of many Black Americans' homes and ultimately resulted in their displacement. And so now for communities that are proximate to highways, there's considerable pollution and safety, adverse safety outcomes that come with that, in addition to being displaced and or being disconnected rather from even the next communities over or other opportunities. And so policy responses to that, again, Dr. Patterson mentioned the federal Reconnecting Communities money that's in the IIJA, that was originally proposed as a $20 billion pot of money, and that was bumped back to $1 billion. While that's a major decrease in spending, it is a first of its kind type of funding for the federal government. And I think the fact that the federal government is demonstrating that this is a priority, in any way, I think is huge, and hopefully is a sign of more things to come. Another aspect of consideration is that there should be new pricing models to ensure that drivers pay for their fair use of public assets. So many Americans believe that gas taxes and other fees pay for the full costs of roads. And believe also that the value of time saved by moving more efficiently is also not, that's not well internalized or incorporated into daily decisions about travel. And so the end result is a system in which the external costs of driving are, really not fully realized or fully incorporated into our current transportation system. Driving is relatively cheap and easy for people who have the means. So, you think about employers subsidizing parking, if that is the case, then an employee is incentivized to drive, and the system is kind of motivating them to do that. And so, just baking those costs into the full external costs that they are placing on the system is a new approach. And one way to do that is through congestion pricing, which is certainly relevant in your area. I know New York City is the first in the United States to really consider it on a comprehensive scale. And this policy would ensure that, like any other demand-based services like electricity or water, that you pay per use, and the more you use of it, the more you pay. People pay for what they use. And so in a true congestion pricing policy, it would be demand-based. So at times of greater demand, so with a driving congestion pricing policy, it would be at peak commute periods. So in the morning and evening peak periods. It would be in the most dense parts of the city. So it would only apply to places where, there is higher demand. The idea is that the funds that are, or the receipts that are generated from congestion pricing would go back into, in New York, this is the case, would go back into improving the broader transportation system. So, the receipts from the fee there would go into improving the MTA system and public transit. And so ultimately, again, serving other modes, not just the congestion pricing system, but rather the whole transportation network. And I want to just pause here real quick and say, yes, I recognize that congestion pricing can be considered a regressive fee. Most other charges that we currently have in our transportation system are also that way. So you think of gas taxes, sales taxes, or parking fees. All of these are considered regressive. And so the idea here and the main way that this would actually promote a more equitable and I think resilient transportation system is that if the revenue that's generated is diverted back into improving other modes that serve everyone, then that ultimately serves the broader system. And so across all of these different ways of thinking about, reforming, the policy approach to transportation to be more resilient, the main goal, again, should be to move toward a transportation system that's not divorced from the environment or the context in which it sits. And the old tools in the proverbial toolbox are the different ways of thinking about how to deliver transportation services that we use right now simply do not work to equitably provide transportation services for everyone to promote accessibility and mobility both. And so, I think rather than focusing on kind of the shiny technology approach, I think there are ways that we can rethink planning, which is something that Kurt talked about in his talk, rethinking the way that benefits are measured and distributed to people. Again, the analysis behind Kurt's work, the different health impacts around the Tampa Bay Rays stadium, I think that's exactly the kind of thing that I think about when I think about, rethinking the way that benefits are measured and distributed to people, rethinking the way that transportation systems are priced, and ultimately, maybe even rethinking the governance and institutions that deliver our transportation services. So I think the policing point is really important there. Maybe that's a system that is not fully working. And so what are different ways of governing or different institutions that we can build around transportation to make it more resilient? So I'll end there, and I'm very much looking forward to our discussion in just a bit.
All right, thank you so much, Brianne. Excellent. All right, I see there are questions coming in Q&A. That's great. Keep them coming. We'll get to those in just a minute. But before we do that, we have our last panelist, who's actually sort of closing keynote speaker, if you will. His name is Calvin Gladney. He is president and CEO of Smart Growth America. Calvin is a nationally recognized thought leader on the equitable and sustainable revitalization of communities. Prior to being named president and CEO of Smart Growth America in April of 2018, Mr. Gladney was the managing partner of Mosaic Urban Partners, a real estate development and advisory services firm that advised nonprofits, cities, and elected officials on how to sustainably and equitably regenerate their communities. In 2017, Mr. Gladney was also the Urban Land Institute's Senior Visiting Fellow for Equity. Over the past 10 years, Mr. Gladney has worked on community revitalization projects in more than 25 cities. He has worked on projects throughout the United States, including Baltimore, Baton Rouge, Birmingham, Boston, Louisville, Memphis, Pittsburgh, Prince George's County in Maryland, and many, many others. Mr. Gladney graduated cum laude from Harvard Law School. He received his BS from Cornell University and is a lead accredited professional. He's a trustee of the Urban Land Institute and a board member from the Center for Community Progress. Welcome, Mr. Gladney.
Thank you, thank you, thank you. And wish I could be in person. And let me tell you, following John, Kurt, Reagan, and Brianne is just tough sledding to be the last act here. But I'm going to make a go of it and try to weave together a lot of the awesome things that were already said. I'd be remiss not to sort of thank the New Jersey Climate Alliance and the Voorhees Center for having me, and also being able to be with such an esteemed fellow panelists, and also with you. And I know in the Q&A has already been lit, and looking forward to more chat and questions along the way. So we know the topic of this forum. We've heard about health, we've heard about justice, we've heard about resilience, all in this context of CO2-Neutral mobility for all. And, just in case you didn't know anything about Smart Growth America, we're trying to help create a country where no matter where you live or who you are, you can enjoy living in a place that's healthy, that's equitable, and resilient. We do technical assistance, advocacy, and thought leadership and conversations with groups like you to really get to that vision, to that North Star. And our integrated approach to community development, which we use the term smart growth, really takes into account land use and development, transportation and infrastructure, and economic development, because we know that communities don't have siloed problems, so they need comprehensive integrated solutions. And so you may be familiar with some of our programs like Transportation for America, National Complete Streets Coalition, Locust, Triple Bottom Line Developers. So you may have heard of us in a variety of different fashions. It's all us. But you're here to talk about health and justice and resilience. And again, I wanted to weave all of these things together. And everything I've heard so far, I want to just say, yes, I agree. And I was also asked to talk about this 15-minute cities concept, which John gave a good kind of quick summary of before. I'll talk a little bit more about it myself. And even this concept of 15-minute cities, it also gets a big yes from me because it has a bunch of great things that we'll talk about. But I titled my talk and my conversation with you today something different. I'm going to call it Yes and. Yes and shout out to Reagan for a bunch of things that actually each of my previous panelists and John kicking things off has said a couple of things that I will maybe repeat just to emphasize, but put it together maybe in a different package. So this is the context, yes and. So let's start on the yes, and let's just talk about this 15-minute cities context and concept. John talked a lot about it, but I like this visual because it focuses on Paris, but it also gives you a really good summary visual that gets to a lot of the things that my previous panelists talked about, but in this context of a 15-minute neighborhood or a 15-minute city, you can basically walk or bike to any of the various things that you need to work, to play, get the services. It really gets to Brian's point about access and accessibility. And also gets to the connectedness that John spoke to. And if we could have more communities that have that level of connectedness, it'd just be really great for everybody. I also wanted to mention this because it does talk about Paris. And I believe John's slide mentioned a number of the global cities, Singapore and others that really have done this. I think Portland's the great example locally. Or domestically. Houston is another city that's incorporated it. But there's just so many great, and there's just a simplicity to this idea. And this was a Parisian professor at Sorbonne, Carlos Moreno, but really moved forward in a grand scale by Mayor Anne Hidalgo, who's the mayor of Paris. And this visual kind of gets to all of that. So it's all a big yes for me, and love the concept, how it can be applied, and it gets to a lot of those outcomes that John, Brianne, Reagan, and Kurt talked about earlier in terms of healthiness, in terms of justice, and in terms of resilience. So that's great. That's all a yes. And wanted to throw some other ways that you can really talk about a yes as well is if we get to this concept of 15-minute cities and neighborhoods. The other thing it does that people don't usually say because they want to use more of the fancy terminology like you might hear at the Harvards and the Cornells, but I like to talk about just getting your time back, that you're not in a car, that you can go do things that don't require auto orientation, don't require a car. We talked a lot about the reasons why you just don't want a car, but just another simple concept, just get your time back, that you're not in a car to do all of the things that you know you need to do on a daily, weekly, or month basis. And this getting your time back really gets to a lot of the things that you see in the 15-minute city or neighborhood concept, where you don't have to even do the simple things like groceries, using a car. You can actually walk to get most of your groceries and that sort of basic level of shopping. So I just like this concept of getting your time back as another way to talk about the beauty and the simplicity of the 15-minute cities concept. And if you do want to raise this back to climate change, and I know a number of the panelists have mentioned this, you can also think about, if you get your time back, you also, particularly if you can get out of an auto-dominated, auto-oriented community structure, street design, city design, and the like, you can actually have real benefits in the fight against climate change. And so this is a version of climate mitigation because ultimately we are driving. That driving, as all of you know, creates more emissions, greenhouse gases, and that's contributing, definitively to climate change. And, how much we drive is directly connected to how much we pollute. And so that simple equation in creating a 15-minute neighborhood or cities concept really can get you to a place where everyone's driving less and you have these climate-related positive impacts as well, along with the health and other justice things that we talked about earlier. So that's a specific yes. It's interesting that John showed a New Jersey version of this We do a lot of work to think about these issues, but we do know that the transportation sector is still the #1 source of emissions of greenhouse gases. And so basically the transportation sector, no pun intended, is driving climate change. And so if we can do the right things to work on our mobility, work on our accessibility, and work on the transportation sector and how it builds out infrastructure, we can actually make a real dent in climate change and really move towards climate mitigation, but also in terms of resilience and adaptation. I'll talk a little bit more about that. And I said we talk about, we're working on these issues. There's a national group called the U.S. Climate Alliance. It's made of, actually has 25 member states around the country. The members are the governors of those states. As you can see, the governor of New Jersey and the state of New Jersey is a part of the U.S. Climate Alliance. And we've been working, actually doing technical assistance with 9 states around the country to really analyze this question of greenhouse gas emissions, particularly when it relates to the transportation and mobility sector. Because when you go from state to state and city to city, what you'll find is that some folks may understand that this is a source of greenhouse gas emissions, but don't really know the aggregate numbers, or don't know, as you can see in this pie chart here, that breakdown of transportation and figuring out in their particular jurisdiction, their city, their state, where exactly are the sources of growth in emissions coming from. And then frankly too, and this gets to this idea of a model, just like Kurt talked about, what are the solutions that actually can deal with the specific sources in that jurisdiction of greenhouse gas emissions, and particularly the growth in those emissions. And so we've been working with the U.S. Climate Alliance and the governors in 9 different states to really, 7 different states in this particular case, to really think about these issues and think about the sources of these emissions and actually get to the places where we can achieve solutions. And one of those solutions could be this 15-minute cities concept, which would frankly get us out of our cars and try to cut back on the ways that the transportation sector itself is a negative contributor to greenhouse gas emissions. Another reason why I say yes to the 15-minute cities concept is frankly because, and sprawl was mentioned earlier, I'm glad, is that when we don't have 15-minute cities or neighborhoods, and we don't have these more interconnected, densely mixed use, mixed income places, when we don't have those things, and you can call the opposite of that sprawl to a certain extent, you can look at the picture on the left as a function, visual of that, it actually costs us more and actually makes us less money. And what I mean by that is from a city standpoint, from a county standpoint, from a state standpoint, the infrastructure it takes to fund sprawl, and no offense to Kurt in Florida, but Florida unfortunately is a very stark example of this, and in a lot of places in the Midwest as well, is that when it comes to infrastructure per public service delivery and transportation, and that doesn't even include the health costs, the more we don't build in a 15-minute cities fashion, the more it actually costs us in terms of literally the amount of cost to service and build those type of communities. But it also makes less. We do a lot of, our economic development team does a lot of fiscal impact analysis. And one of the things that is clear is that when it comes to property tax revenue, sales tax revenue, and any type of fiscal revenue at the city or county or state level, when you look at places that look more like 15-minute neighborhoods, that are more densely packed, like the visual on the right, that have a mix of uses, those are the places that actually generate more money for city coffers that then you can use for social services, then you can use for restorative justice, then you can use for the type of environmental justice and climate mitigation things that we're all talking about. So 15-minute cities also has a great benefit of actually being the best, most financially feasible option to move forward. And it's something that we should talk more about. Actually, Reagan mentioned our Dangerous by Design report that we just came out in 2021. But one of the, I would say, reason to say yes, potentially to 15-minute cities and 15-minute neighborhoods is that actually, and Reagan talked about this, you might kill less Black folks just to put it real commonly. And Reagan mentions this statistics. I'll show you just the visual from our report. But 80 Black folks died as pedestrians in traffic incidents, in traffic crashes, 80% higher death rate than the sort of overall population. And if you look at the American Indian, which is what the census called it, but indigenous people, that number is 221%. So people of color are disproportionately dying as pedestrians. And if we actually had less people driving, that should help, right? And that would be a good yes as well. And so that's the 15-minute city concept. There's a lot of reasons to say yes, but I told you earlier that my conversation with you today is called Yes and. So I have some ands, some buts, and some hmms to kind of share with you as well. This gets to the part, as John mentioned, thinking a little critically about the concept as well. So hopefully I'm going to get to try to push you a little bit in your thinking and widen the scope of how we both implement these ideas and think about them in general. So this is what the visual looks like and thinking about it in Paris, but wanted to share with you the idea that when you think about this concept of the 15-minute city or neighborhood, and whether it's applied in Paris or Houston or Singapore or wherever it's applied, equity is not the default option. And if you think about a lot of the concepts and the things that it talks about, and someone mentioned this earlier, a lot of it is about mode shift and mode, having different modes at your wherewithal within a 15-minute, radius. But it actually doesn't explicitly and specifically talk about equity as one of the outcomes. And as long as equity, and as you know this, as long as equity is not a desired and specified outcome of anything you do, it's not going to be the default. And so one real question about any of these 15-minute cities or neighborhood concepts is whether equity is actually going to be the result of the activity. And you can think about our history of transit-oriented development and a lot of the application of other great ideas, particularly ones taken from European cities that don't have the same history, whether that's a racist history, bad infrastructure history, bad street design history, disproportionate auto orientation history. A lot of those places don't have the history that we have, and therefore you're not going to get the outcomes necessarily by singularly applying them, and equity is one of them. So I wanted to talk a little bit about history, and Reagan talked a little bit about this as well. But if you think about the concept of 15-minute cities, a lot of this is going to require rezoning. But we know that zoning has been used as a tool of inequity. You can see it in this cartoon. This was an actual cartoon in a major city newspaper back in the day. And unfortunately, that spider was supposed to represent African-American folks in St. Louis. But we know that zoning, and Minneapolis is trying to go in the opposite direction, and Breon mentioned that. We know that zoning has been used as a tool in inequity, and even now the current zoning in place in a lot of places, even if it doesn't have racist intent now, it has racist outcomes by virtue of the things that it crystallizes in place, and really particularly segregation. And so having a history of zoning, having a history where, as Reagan showed in Detroit, and I'll show you in Miami here, where essentially the Black Harlem Jazz District was overrun by this highway. You can go to Austin, where Mexican Americans at the time and some African Americans were bifurcated from white communities using transportation infrastructure, just as Reagan talked about. So when you have this context of zoning being used and the zoning of today still having regulatory effects that are racist and racialized, when you have a history of transportation and other infrastructure being used with racist intent or having really bad financial, wealth building, and community connectivity outcomes to it, when you have that kind of history, and here are just a couple of book recommendations. A lot of you have probably read The Color of Law, but the one in the middle I wanted to focus on particularly because if you think about a 15-minute city concept, it talks about being able to access all of these resources. A lot of those resources would be in small businesses if you're going to do this around an entire city. And there's always been disproportionate racial outcomes, and in many cases, racist intent and racial bias in how small businesses can get funded, particularly when it comes to people of color. And so the Color of Money talks about this in the context of banks. And so if you overall take the 15-minute city concept and say, does it talk about equity affirmatively and explicitly, you start to have some concerns, a yes and, because you wonder whether our history of zoning, infrastructure, race-based business support and the like, and the way we value our properties and lives, as you can see in my buddy Andre Perry's book, Know Your Price, these are all challenges that we have to think about if we're going to implement this concept. And it is a surmountable problem, but it's something we have to think about. And part of the challenge not only is thinking about the history, but thinking about the current times. We are actually more segregated than we used to be. And I sort of clean this up to make this a very simple visual, but all you need to know about these bars here is that the number 1 and the number 2 represent suburbia and the city. And number 4 is suburbia, number 4 is the city, and number 5 is suburbia. And what you're seeing is, if you look in numbers 1 and 2, that's 1950. And in 1950, the number 1 bar represented that, most people actually look at 1 and 2 combined, most people in the country were white at that time. And so, there were some people of color that were in the suburbs, which is represented by number 2. And there were some people of color, in number 1, but it was a real mix. But if you looked at here, there was segregation just in the sense of by default. But if you fast forward to, the 2000s, what you've seen is segregation has persisted. So if you look at the number 5 bar, the number 5 talks about the suburbs. And now you see that most of America, if you look at all of these combined, now lives in a suburban environment. But but it also shows, unlike in the 1950s, where you saw a pretty even split, those orange bars where white people live both in sort of city-related areas, metro areas, and the suburbs. But now, most of the white population lives in a suburban area. And frankly, most of the white population in a suburban area lives in a mostly white area. And so we are actually getting more segregated over time. And so the other question is, if we implement the concept of 15-minute cities, how does that work if we're already very segregated? Will that exacerbate segregation, which can't possibly be a means to getting to racial equity and restorative justice? And so it's just another yes and for me. How do we deal with the current function of segregation? We talked about traffic fatalities and disproportionate deaths around Black and brown people, particularly African Americans, and Reagan kind of hit this right on the head. The other yes and I have a question about is, one of the things I thought about was, well, if less people drove because they are in these little connected 15-minute neighborhoods, maybe we would just stop running over Black and brown people as much. But as Reagan talked about, Black people were more likely to die in traffic accidents. We saw just in 2020 data. So even as we drove less during COVID, Black people actually died more in traffic fatalities. And that increase was 23%. And that increase was the highest of any group in the country. So actually creating these more connected communities, implementing a 15-minute city strategy might not necessarily do anything for dealing with pedestrian fatalities disproportionately happening among people of color. So we just have to think about that, a yes and. Also, we talked about resilience. I heard it mentioned in a couple of places. And so I'm going to say, when we think about 15-minute cities and maybe some of the benefits, you wouldn't, if you had an extreme weather event, you might not have to go as far. You might not need a car to kind of get to resources. But one question is climate resilience for whom if you implemented this concept? And I want to push everybody on this. And I know this is sort of common phraseology, but I actually wanted to get us away from this concept of resilience. And no offense to my fellow panelists. But the concept of resilience says we should be able to withstand all of these bad things, and we'd be more resilient as the bad thing happens to us. So yes, the weather event will happen to us. Yes, all these climate change things will happen, but we will be stronger against it. And what I want to take us to, and a lot of that resilience comes from a culture that disproportionately, and instead of federal and other decisions, that disproportionately put people of color in harm's way. And so we force them to be resilient and puff out their chest and say, I'll stick it through the hurricanes in Florida. I'll stick it through the flooding events in Louisiana. But it's because lower income people and people of color were put in these places without the infrastructure and right in harm's way in terms of a lot of these climate change effects. So where I want to get us to is not resilience, but adaptation. And adaptation, particularly if we're thinking about equity, must be done in a way that's going to disproportionately benefit those who are put in harm's way. And so just a little bit of a history, and I'll speed things up a little bit. The history of redlining, which we know a lot about, often doesn't get talked about in the context of climate resilience. But this is just a study that was in Philadelphia, and I know it's near New Jersey, so thought it would resonate. And it basically showed that the places that were redlined in the past are the ones that disproportionately have, heat islands and disproportionate heat compared to other parts of the city. And the main information and knowledge there is to say that when you look at tree canopies, the different concrete that's used, porous pavement, the albedo of the surface areas, basically the reflectivity and whether there's covering and the like, these areas are hotter, and they're disproportionately hotter where people of color live by infrastructure and street design in the past. And so when we talk about 15-minute neighborhoods, if we take existing neighborhoods that already have these setups, maybe they won't be as climate adaptive, and maybe they won't be as climate resilient, because you're basically crystallizing the racist decisions of the past in these disproportionate bad outcomes that you already see. So how do we get out of that box is another question I have. Public transit, we talked about it a lot here, but 15-minute cities doesn't really talk about public transit in a way I would like to talk about it, because you can end up with these connected communities that are walkable and not really do anything about public transit at all. And I'm going to give you kind of a New Jersey example of that. So this little chart goes throughout the country and looks at a bunch of states, including Washington, D.C., and says, what percentage of low-income units live in above average walkable places? And you can see all the states, and DC comes out number one. So if you're a low income person, you can actually still be an above average walkable place in DC. And New Jersey is doing very well. They're one of the best states in terms of lower income folks still having an above average walkable place. That's great. But here's another bar chart. And this talks about the percentage of low income units by state in locations with at least moderate levels of transit accessibility. And Breon mentioned accessibility earlier. And so this shows, well, if you're a low income person, what's your ability to access moderate transit accessibility? But in this case, New Jersey is way down the list. So you can very easily think about 15-minute cities being created, these very walkable, connected communities, but they actually don't have the type of public transit access that can get you the jobs. And ultimately, I'm going to ask, and I'll say this casually, where are the jobs at? So we can have all the connected communities we want, but if I cannot get to the jobs, if people of color disproportionately can't get to the jobs, if lower income folks can't get to the jobs, then what do we actually accomplish? So it's another part of my yes and. And then I'm going to land on this last concept, which is build it and they will come. And this is from Field of Dreams. And you heard the voiceover where he says that. And I want to ask a really tough question that we should all ask ourselves and really say, if we build these 15-minute communities, if we make these infrastructure changes and put the money in place to do that, will they come? Will they? Let me just give you a quick side-by-side set of anecdotes, and we'll end with a little bit of solution. So you can ask yourself, will they come? And let's take you to East Baltimore. And this is a story about the East Baltimore Development Initiative. I was working on this project, and Johns Hopkins has a medical center. I don't know if anybody's been there, with about 19,000 employees that swarm that area every single day. And we did what was called a cognitive mapping exercise with East Baltimore residents who are, probably over 90% African American. It's a disproportionately lower income place, unfortunately, and has disproportionate vacancy and a lot of challenges. But it's on the move. And one of the things that the East Baltimore Development Initiative was trying to do, and I led, was community engagement with East Baltimore residents to think about how they thought about this revitalization. And so we did a cognitive mapping exercise. I don't know if anybody's done that before, but the idea is, can you get people to draw what they think about an area? So as opposed to forcing them to speak and having the speaking or writing or presenting be the way they communicate, they just draw how they think about an area, and you can learn more about how they think because it's more subconscious, but it also is more equitable because not everybody can get up in front of a microphone at a community meeting. So we had them draw how they thought about Johns Hopkins in relation to the East Baltimore neighborhood. And what we found is when they drew Johns Hopkins, they drew it dramatically big. They drew gates, they drew barriers to walking into the neighborhood. And actually the reality of this campus is that it's all porous. Anybody can walk through the campus through a number of streets. It is actually a very accessible campus to anybody who lives in East Baltimore. There's no barriers at all physically, but psychologically, people feel like that place isn't for me. And these were mostly African-American, Black and brown residents. And from a subconscious standpoint, they felt like that isn't an area for me. And so they just did not go in there. Despite some of the things that they could get and the amenities that they could access, they just never walked through those on those streets or through those gates. Let me compare that to another story, and this is a DC story as well. This is the great Howard University, HBCU, historically Black college and university, located in Washington, DC in the rapidly gentrifying Shaw area. And the story just a year ago or 2 years ago was, and you can see this beautiful campus, it looks just like many beautiful campuses around the country with the well-manicured lawns. Again, historically African-American community, university within what was a historically African-American community, but gentrifying rapidly. So a number of white and other residents moving into the area with higher incomes than the normal residents, which is one way you could describe gentrification. And so this article came out where what was happening is white residents of Shaw were walking onto Howard University's campuses with their dog, and basically they were starting to sunbathe on this private university's lawn. They were letting their dogs poop on the lawn. They were having the dogs run and play Frisbee, but this is a private university. And I sort of put those examples side by side because the question is, build it and will they come? Because what you can see is lived experience might tell people something different in terms of freedom of movement and where they think they might be free, because the newer white higher income residents of the Shaw neighborhood felt totally capable, willing, and comfortable walking onto a private universities through the gates of a university and doing all sorts of things on private property. They felt comfortable doing that when nobody told them whether they could or they couldn't. And you could see how people of color in another environment with an open environment with no real barriers might not feel comfortable. So it's a yes and this is kind of what East Baltimore really looks like today. And you can just see how you can actually walk right onto Johns Hopkins campus, but the psychology is different. So we have to take into account lived experience when we try to implement 15-minute cities. Let me land quickly with just a solution set for you. And all this does is to say, let's take a 15-minute neighborhood and broaden the concept. One is to think about, if you look at on the right side, public transit to a job center. So let's not consider it a 15-minute neighborhood if you can't get to public transit to a job center where most of the jobs are. That sometimes is a concept you hear about in 15-minute communities, but it should be a key component. Also, equity needs to be one of the defining outcomes and desired outcomes of the design of any 15-minute neighborhood and city. And that needs to be part of the design, both in the engagement and thinking about different lived experience and thinking about the psychology of creating them. You also see streets for all users and all abilities. Oftentimes, everything you hear about 15-minute communities is about walking and biking to places, but you got to add the concept of being able to roll to a place, whether that's somebody using in a wheelchair, using an assisted device, using a cane, whether it's somebody, a mom with a stroller. We just need to broaden the concept in our implementation. And that's where we can get to a final answer. And finally, I just wanted to mention that we're going to continue to talk about these issues at our kind of National Equity Summit in January. So hope to have you all join us there. But hopefully that kind of started to wrap together some of the great conversation that my fellow panelists had. I want all of us not to be in a place where we forget public transit, we forget equity, and we forget that unless we design 15-minute cities, 15-minute neighborhoods, 15-minute communities in a way that makes equitability and equity and racial equity and environmental justice and climate justice a defined and desired outcome of that design, we will not get there because equity is not a default option. Thank you.
Thank you very much, Calvin. Excellent. And thank you again to all the panelists. We do now have the opportunity to do questions and answers. So we're going to do that now. I have a few questions, and I know there are questions in the Q&A from the audience. So I'm going to actually try to go to those first. If I can get my Zoom app up here. All right, so the first question that we received was actually during Curtis's presentation, and pretty straightforward question. Is the Healthy Mobility web portal a publicly accessible tool? And if not, how does one perhaps access it?
Yeah, it is publicly accessible on our site. I believe it was linked in the chat. There's a disclaimer that says that this does not warrant any individual health outcome. It's looking at community health, because we don't know if somebody is chain smoking all day. So we, our legal team made us put it up there. I will note that something I said before is that the model looks across the entire state of New Jersey right now. So in order to get the best data, you would want to work with us to help calibrate it for, say, a study area or a county. That way you can compare one area of the same neighborhood or same city to another area rather than across the entire state footprint.
Great, thank you so much, Curtis. Another question kind of at the intersection of health and neighborhoods and cities. Question about vulnerable communities' access to, and would they benefit from urban farms, kind of urban agriculture, and what your research, in particular to Reagan and Curtis, the question was addressed, what your research has shown in that regard.
Reagan, do you want to go first?
Reagan, you may be muted. Or Curtis, why don't you go ahead?
Yeah, yes, that's something that we're able to model and see if there's a statistical correlation. Intrinsically, yes, we would believe that to be the case. But the reason for the modeling is to see if it does have that, using the regression to see if there's a statistical correlation. I believe in the example I showed around City of St. Petersburg, we did show that the census tracts within the half mile of a grocery store, which isn't the same as urban agriculture, but does provide that access to fresh fruits and vegetables. did have a statistical correlation on those 6 chronic diseases.
All right, great. And Reagan, go ahead. For some reason, Reagan, you're unmuted, but we're not getting audio. Can you maybe check your microphone to make sure that it's the right one? All right. Nope, still not working. Darn it, darn it, darn it. Maybe we can figure that out and we'll come back to you. There were quite a number of questions, and this maybe is to any of the panelists, how you guys all think this may work out on the national level. A lot of interest in the reconnecting communities aspects of the infrastructure bill in the context of the topics you guys covered. And one of the aspects of past infrastructure investments and things have been this shovel-ready nature of projects, and reconnecting communities being a very new concept, I think, to transportation legislation or transportation financing. How do you think that the rollout of that program will work in terms of shovel readiness?
I can maybe start with this. So I think shovel ready is important. I think shovel worthy is another way of thinking about this. And I can't find the question right now, but I think whoever asked the question maybe also raised that notion. But is this a project that is worthy of investment? Is maybe the first question that should be asked. And so I think that's just as important to think about as is shovel readiness. In terms of how it will be rolled out, I think that those details are still being worked out. I'm curious if any of the other panelists know more about the actual implementation of it. But again, I'll reiterate the point that it's so monumental that this funding was included in the package. Again, I mean, it was pared down quite considerably from what was first proposed, but I think the fact that it was that it remained in the legislation is hopefully a sign of good things to come.
Great. And Calvin?
Well, I was going to jump in. Like Brianna, I would say, well, one, thank you, feds, for giving us these funds, but it was vastly cut down. And frankly, even the original numbers, and we did a lot of work on this issue specifically. Ultimately, we're spending hundreds of billions of dollars to do the type of highway building and highway expansion work that both is not just historic, as Reagan said, but is current. That's going to get to the same bad outcomes that all of the panelists and everyone here is trying to avoid. And then we're creating this very small program. It sounds big, $10 billion, but it's very small when you think about the literally hundreds of communities that have been ripped apart because of our highway building back in the 1950s. So first of all, it's not enough funds, and it's going to have less impact than we would like, just because of the sheer lack of funds to do what you want to do at scale. The other thing I would say that I think is important is that if we're going to talk about reconnecting, that we still are overly focused on the built environment, even though it's a infrastructure bill, obviously. But if you think about the difference between equity and restorative justice, the disconnection of these communities was a wealth extraction moment. Reagan showed that particular corridor in Detroit. You can see the corridor that was a thriving corridor where the Claiborne Expressway in New Orleans was put. But in many of these places, thriving Black and brown businesses and millions of both historic wealth and wealth that would have been transferred generationally through small businesses, through home purchases and alike, were washed away at the same time you had this disconnection. So if we want to do it correctly, we're going to have to think about how do we work on small businesses, entrepreneurial activities what is the wealth building aspect of this reconnection? Because literally, I think this might have been in the one of the questions, literally just tearing down a highway that bifurcated a community will not reconnect that community. And the reconnection alone is not just built environment. It really is, how do we get past and how do we undo the wealth extraction that happened so that this reconnection is a wealth building moment as well?
That's a great point. Thank you so much, Cal. Several questions as well, kind of in the context of electrification and the significant infrastructure investments likely to be made related to charging infrastructure and things like that. How can we best think about the deployment of those dollars and that infrastructure in a way that promotes equity and community building, as opposed to just sort of laying out infrastructure across the landscape and giving incentives to people of means that can, afford the individual cars. I think that, the concept of car share, last mile kind of connections, or community car share, where it's more co-op nature, that kind of thing is what they were thinking about.
John, I'm working on a EV master plan right now for Orange County here in Florida, and that is one of the metrics we're looking at in environmental justice areas, as defined by our Metropolitan Transportation Organization. So they use 7 different criteria: zero car households, poverty status. I won't be able to name them all right off the top of my head. Limited English proficiency, like single female head of household with child are some of the metrics they use. So we're using that to make sure that the proposed locations for charging infrastructure doesn't leave a gap in underserved communities. But I'd love to hear if anybody else on the panel has a good methodology to use, because we're still writing this as we go.
Kurt, I think, just gathering the information and knowing knowing where the needs exist most is certainly the first step in it. I think part of it, something I mentioned in my discussion, was thinking about how to reform institutions or the governance mechanisms for maybe deploying new technologies. And I think, emphasizing grant funding that goes to community partners or nonprofits that are already on the ground, already have connections in place, but working with them to deploy new tools is what I'm thinking of when I think of reforming institutions.
That's great. Reagan, did you get is your mic back working? Oh, still not. Darn it. I'm sorry. All right.
No, the Washington Post had a great article on EV charging and equity, I think on either Friday or Saturday. So that's right in Reagan's neighborhood.
Maybe you can write in chat if you have something to offer. Sorry about that. I'm not sure what's going on. I had a sort of something that Bran mentioned about the governance and the kind of institutional framework of how we provide transportation. And I wonder if she or any research, kind of points to a new model for the governance of transportation that we might be looking towards as well.
Yeah, so we've done work on this in a lot of different contexts, some of which that come to mind first are thinking about reforming transit governance. We recently did work on reforming transit governance in Central Maryland. So Baltimore's transit system is not run by as a kind of municipal transit authority like so many others around the country are. It's rather run by the state, which is also the case in New Jersey. So we looked at different forms of governing. How do you create maybe a board that is representative of the people that are served by the transit system? And what implications does that have for how the service is funded? Again, who's represented on that board? Rider groups, or rider constituency groups, how are they represented when any key decisions are made about how to run or build transit? We've also recently done work on, and I know somebody asked about this too in the questions about delivering rail transit. So yes, absolutely, it is so costly, and often projects get delayed beyond their original due date in the United States. And so how can we, what role does governance in the institutions that govern how rail projects, or any transit projects for that matter, are delivered in the US? And how can we empower public sector employees to be able to make decisions? So often a lot of the decisions are kind of put in the hands of consultants, which is, consultants certainly play a huge role on delivering projects, but ultimately, we need to empower public sector decision makers to make some tough decisions on projects. Calvin, you have some thoughts on that?
Well, one, I can't believe you just threw Kurt under the bus. You said the consultants. Oh my gosh. I just wanted to add to that and say that part of the challenge is, if you even look at what we're talking about today, we're trying to get to healthier, more just, and more resilient outcomes that are equitable for communities. Those are interconnected, interrelated outcomes, but governments, and particularly our transportation sector, is built in a very siloed way. So not only do we need to do the things that Brianne was talking about, but if you want to get to the health outcomes that Kurt's VHB model can help you assess, you can't have the Department of Health in one building doing whatever they do on their own. The people who are dealing with real estate and housing and land use in a different building, different agency, transportation in a different place, transportation agency who isn't a transit-oriented development-focused agency trying to work on the integration of the two. Part of the challenge is, and a rethink that needs to happen to say, if we really want to get to these interconnected outcomes, how can government agencies work together? Because you can't have the Department of Transportation make its own decisions, then the Department of Public Works, who often are the ones focusing on street design, pedestrian infrastructure and the like, if they're all making their decisions separately and not focused on the same goals and the same outcomes and the same inputs, to think about even, every tool is only as good as the inputs and who actually has the data, then you still have the same problem. So how do we break up the silos in sort of government structures as well to actually get to better outcomes?
Yeah, and just to piggyback on that real quick again, I'm sorry, Curtis, I did not mean I absolutely think there is a role for consultants to play. It's more just the point of how does that role work with existing public sector institutions, and how can public sector representatives, be empowered to make decisions? And then with respect to the coordination point on, public sector decision makers, we see this so often with NEPA and the environmental permitting process, how those decisions have to go through kind of the gauntlet just to be acted upon, and a lot of that could be a lot of the duplication could be eliminated by better coordination earlier on in the process. So we all talk about this in our rail infrastructure project delivery report.
Excellent.
No offense taken.
Yeah.
I think Calvin's a recovering consultant.
Yep.
Consultants have thick skin anyway. All right. I know Reagan was trying to kind of log out and log back in to see if that fixed it. I'm not sure if it did or not, but one last question, and then we got to kind of wrap up here a little bit. Calvin, you mentioned multiple times the importance of public transit and not ignoring public transit when we focus on the 15-minute walk or bike. Reagan, during her presentation, talked about the free and freedom related to public transit. Are you all aware of, I know there are a slowly growing number of examples of systems that are making the public transit service available for free. Are you aware of any studies that have looked at the benefits and costs of that with a kind of broader lens than just the fiscal issues that the transit agency might experience?
Well, one, I think Reagan may be back. Are you back, Reagan?
I am. Can you hear me?
Hey.
Yay.
Well, I'd like her to answer the question because Reagan, you talked about this, and we're on our final minute. So aware of studies like John mentioned?
Thank you, Calvin, for this space. Yeah, I'm going to touch on a couple of things just to get it all to in this minute. I'm so sorry. But in terms of fare free transit, and so there have not been studies about the effects of it, just because there have not been agencies that have really done it or done it that long. And so I mentioned the Boston, how Mayor Wu just recently extended their pilot. But again, that was a pilot. And so that is just an example. A long time ago, Kansas City was going to deploy fare-free transit, and then they were still dealing with fiscal issues around that. And so there's just not a lot of examples around, at least that I'm familiar with, around this, just because of duration of these pilots that have been going on. During COVID, a lot of agencies did do fare-free transit for ridership. I'm not sure if there's any studies that have been out based on doing fare-free transit during COVID. And I do know that a lot of transit agencies are reducing or continuing fare-free transit because they, as a mechanism to actually get riders back onto public transit systems. They were doing that here in DC, and right now currently there's like a $2 at all time bus fare, again, to encourage people to get back on it. But when people talk about funding and how our city is going to fund this, it's a policy choice. Just like everything else, unhoused populations, that's a policy choice. Funding for all of these are policy choices. And again, it's really reorienting public transit as a public good. And so as a public good, government has a responsibility to pay. So often we hear, oh, government doesn't have money. From the federal level, we have hundreds of billions of dollars to give to defense, just like that. But we have to question public goods and services such as public transit. We have the money, it's how we allocate the money. And on a local level, it's very similar to that. We give so much money. There was a great talk about mobility justice, and I forget the speaker's name, but he discussed how we can give money to policing for a $1.50 fare. So we'll pay money to police people who can't pay a fare, but that fare is only $1.50, but you'll still pay a police salary to police fare evasion. And so again, it's about allocation of funding. And so when people ask, how will we pay for it? We always ask, how will we pay for a public good? But we don't ask, how will we police bodies? How will we spend on defense? And again, defense is also another way of policing bodies, but we never say, but we always ask, how will we give public goods and services?
Great points. Thank you so much, Reagan. I'm glad we got you back. All right. Well, thank you so much, everyone. You did a great job. Hopefully, we met our goal of educating and enticing people to stay involved in our project. I did want to just say a couple words about our next steps, which will include the 8 workshops that we talked about, county-specific workshops that we'll be holding in January. We're also going to be holding a youth visioning workshop, which will be targeting future leaders that are 14 to 18 years old in their own sort of, with their own venue. The purpose of those meetings is to sort of take the concepts that we've explored today and apply them at a more local scale to identify needs and desired long-term outcomes that have some context specificity to them. So different places in New Jersey will have different lists of needs and outcomes. From there, we're going to select 3 to 4 locations in New Jersey to conduct neighborhood scale planning assessments and come up with specific recommendations for those areas that will also inform us scaling up a strategy that can be used to develop recommendations for kind of statewide what needs to happen to make our vision of a healthier, more just and resilient carbon neutral mobility pattern in New Jersey come to fruition. So all of that is coming in 2022. We look forward to working with the Climate Change Alliance on seeing the project to its conclusion. And you guys can take heart that you were part of the beginning inspiration for those planning activities that will be happening in 2022. And we very much appreciate all of you being here today. We appreciate everyone that joined us in our audience. And with that, we'll close, and I hope everyone has a very healthy and safe holiday season. Thank you all.
Thanks, John.
Right,
Bye, everyone.
Thanks for having us, John.